Okay, good afternoon. Happy Monday. Thank you guys so much for joining us. My name is Felicia Sprague. I'm a regional manager in Toronto.
And I am Dr. Aisling Whitaker, a dentist and office manager, or I was going to say office manager. That's you,
Clinic
uh,
owner.
clinic owner in Toronto, and we are both the co-founders of Dental Hive. We're going to be discussing today how to essentially take a pulse check of your clinic. And we do this with a monthly survey, but also with quarterly meetings together, where we collect KPIs, the key performance indicators, and we compare them to industry benchmarks or standards. So some of these benchmarks have been, adjusted since the pandemic, and they could be province or state specific. And they do reflect the fee guide in your area, but a lot of these percentages are pretty standard across our industry. So you can generally look these up on Google. We'll give you a sense of a range that we look at as well.
So, how do we discuss all that information? We have a managers meeting. So, I usually suggest doing about 2 to 4 managers meetings per year, just sort of depending on how often you can kind of set aside that time. If you're doing 4 times a year, you would do it every 3 months. So, April, July, October, and then January, because you're discussing a quarter at a time. So, you're discussing January to March and April and so on. If you decide to do it twice a year, which is what our clinic does some years when we're crazy busy, you would just do like July and January so that you can talk about 2 quarters at a time.
And I guess why this is important. So, before I owned my own clinic, a lot of the offices I worked in, they never really did this. And a lot of dentists I've spoken to, on the talking circuit or friends of mine, don't do this. But this is a really important way of getting measurable data of where your clinic is at and also tracking your progress over time, being able to set goals and see your clinic grow. You can also, by checking in, monthly on your stats, but quarterly and discussing this with your management team, get some good insights on how you can make some different decisions and how you can progress and really see your clinic thrive.
Yeah, absolutely. And also, when you pair that with a really great like business accountant that can provide you their own insights from the data that they gain, together with all this information, you can really put it together to see what you need for your business moving
Mhm.
forward.
Yeah. I'm quite surprised really when I chat to people who own clinics or who run clinics that a lot of the time, we get so caught up in the day to day of
Yeah,
being in there because it's
yeah,
insane,
absolutely.
it's busy. Those of you who are on a break right now are like, I have, 10 million things coming at me on the fly all the time. But by sitting down and actually getting a real grip of where your clinic is at, like that is really the only way that you can make the clinic more successful over time. So you have to set aside the time to do it.
Yeah, absolutely. I think it really helps if you want to see growth in your clinic.
Yeah.
And also, we do these meetings with just like the dental clinic owners and our management
Sure.
team. There's just information here we're talking about that the whole team doesn't need to know.
Yeah.
So, we're deep diving into some of these metrics. So you can pick out some relevant ones that maybe you can discuss at your general team meeting that will help with like goal setting purposes. But overall, it's just managers and owners.
Yeah, I agree with that. I think we've both been in clinics in the past where every team meeting was like a financial stats
Yeah,
meeting
you're sharing too much information. They're like, oh, I
way
don't
over
care
your
about
head.
production. I don't care about this. And it's just
Yeah.
like, they don't need to know.
They don't need to know. They need to know what their specific goals are and how you're getting there and their part in that journey, but they don't need to know the ins and outs of every dollar that you're spending.
Yeah, exactly.
Okay, so
Oh,
what's our plan for today?
yeah, so I am going to drop in the manager's meeting document into the chat so everybody can see it. So this is kind of what we do at our quarterly meetings. What's really important is for you to keep track of some monthly statistics. So we do have a KPI worksheet that Ashling will share as well in our chat. And this will kind of give you some guidance of things that you should track monthly within your clinic. And then the managers meeting PDF that is also in there. This is going to help you at your managers meetings, you know, every 3 months or every 6 months.
So let's take a
So,
look at these financial, let's start with the
yeah.
financial stats that we go through.
Mhm.
So while Fel's bringing that up, so we're going to go through the manager meeting, her her worksheet that she goes through. As she mentioned, we do have a monthly template and it's inside Dental Hive resource section. Both of these are. So if you want to start going through the nitty-gritty monthly, we highly recommend that. And then you kind of bring this together for your quarterly meetings, or 6-month meeting, whatever way you want to do it, to look at things as an overview. Because what I find is you can have a good month and a bad month. Some months are 5-week months, some weeks are 4-week months plus a week of vacation. And so looking at it as a full quarter is a lot more meaningful than going week to week. But obviously it is important to have that nitty-gritty information so that you can bring this together. I can see you, Phil.
Perfect. Okay, so this is kind of like what we track monthly. You want to go over some financial metrics. So what is your total monthly production? We also do production per provider. We'll separate it into production per hour because it's really important that you're setting all of these little goals for yourself. And then we'll tally our total production and then production minus labs because those are really important to differentiate. We'll
Now,
also look
those are
at,
big because we're
yeah,
individual providers. So I want to know what the production value of
exactly.
growth of the clinic is.
For sure. Collections, like accounts receivables, we're looking at patients. How many new patients did we get? How many did we lose? How did they find us? Like, we have so much information that we're gathering because this is going to help across the board with marketing, our different reports, our manager meeting. All these are going to kind of help us decide what are we going to do next? Where are we going to put our money into marketing? Like, are we getting a lot of patient referrals? If so, let's put our money into our patients, let's give them gift cards for referring. So there's lots of different metrics, and we've kind of separated it here. So this is sort of what you should be looking at monthly, and then you're going to pull out the information here to put it into your manager's one. So I'm going to share now. Okay, everyone can see this?
Yeah.
Ash? Okay, perfect. This is sort of what we do for our managers meeting. So we have the key performance indicator on the left here, what kind of the industry benchmark is, and then any notes we might make on the right-hand side. So staff salaries, we look at our staff salaries in a month. We're going to kind of divide that by our total production for the month. And then we should be somewhere in the 20 to 25% range. If we're under that, we're doing well. It could also be a potential for growth. Like, this is when you're going to look at, is there anyone in your clinic that is doing a great job and you think that they deserve more money right now? Is there a position that maybe you could look at hiring? Maybe you're looking at hiring a treatment coordinator. Maybe you're a newer clinic, you're finally ready for a manager. This kind of indicates how much room you have to grow in your salary range. If you're well above this 25% range, that's obviously an issue. So you have to look at, okay, what are we doing in our production that is not aligning with how much staff we have? Like, maybe you need to cut back your hygiene if, like, you are having a lot of empty slots in your schedule. Maybe you need to kind of reduce to one hygienist if you have two. So definitely, this is a good indicator of where you can add to people's salaries or grow, or maybe what you need to do sort of next in terms of production. We also have clinical supplies. This is going to be your supplies for, all of the office in the back and the front. Somewhere around 6 to 8% of total production should be around.
And that's a good one for really seeing, are you overspending? Because there's certain things that you're
Mhm.
going to be, you're always going to need restorative supplies, hygiene supplies, that type of thing. But a lot of the time you can find that you're overspending in certain areas there.
Yeah,
Maybe buying a lot of stuff that's expiring.
yeah.
So keeping your lean inventory. If your clinical supplies are going way over, 10% of your production, then there's definitely a serious problem there.
Yeah, absolutely. Lab fees. So we say about 10 or 7 to 10% of your production. Now, this is actually, I feel like it has changed since we've gained a lot of stuff like our offices have a sprint ray. So then we do a lot of like our production ourselves. So then that lab fee, like we sometimes are at 20% because we're just producing so much of our own stuff that we can get it out quicker. And it's all of our lab fees are kept in office. So I think that that's something to kind of take into account.
Mhm.
But if you are using an outside lab, you should be around the 7 to 10% mark.
And I think
And
you are using an outside lab and you are spending a lot, it's a
hmm,
consideration for what you should be bringing in-house.
yeah, exactly. That's a conversation to have. Like maybe we should be producing our own night guards. Just like if, you're looking at referrals and you're like, oh my gosh, we sent to an endodontist 20 times the last few months. Maybe we should get our own endodontist in here 1 day a week. You know what I
Mhm.
mean? So it's definitely something just like a specialist that you need to consider maybe bringing in-house to kind of keep all that money inside.
Yeah.
Advertising, this is kind of industry benchmarks. We don't do a lot of advertising. We'll do some like Instagram stuff, so like Instagram or Facebook. I've been at offices, well, they'll do like billboards and everything like that. So whatever you do, you kind of are looking at between 1.5 and 3.5% of your this is all total production. Office supplies, we have 2 to 3%. Now, these production per month for the dentist and hygienist, this is sort of based off of, our fee guide here in Ontario, how much, like for the hygienist, how much 4 units of scale is based off of about 7 or 8 patients a day. We did lower that a little bit from the 4 units times 8 people, just because we want to account for things like we're doing scanning, our hygienist might be seeing Invisalign patients. So even though there's no dollar amount assigned to those, it kind of is in our head, right?
So I think for your office, when it comes to hygiene production, look at what your ideal day looks like. If your ideal day is 8 patients, let's call it,
Mhm.
with a bit of variation there. Make your ideal goal 7 patients because you always have to anticipate that there will be a cancellation of sorts or something along those lines. Then have a think about whatever your typical patient looks like on average. Like Felicia said, maybe you're doing a lot of perio patients, maybe it's 4 unit scale, maybe it's 3 unit scale, maybe whatever that looks like, and work out what your average uh, day looks like at about 80% filled. Then you have a rough idea of what your goal is per hygienist per day. It also, when you look at this in terms of choosing to grow a hygienist, which we haven't added this into here, but it's something that we think about together, is
Mhm.
what percentage, how busy are they? What percentage of their chair is booked? That gives you an idea of over time when to add that extra hygienist in. So
Yeah,
if your
exactly.
hygienist is underproducing, you have to go back and look at a few sample days to see, are they billing appropriately? And we believe in very transparent, very clear billing guidelines. We don't overbill any patients. We're very, calculated in terms of how we do that. But we also don't want to be underbilling and undervaluing that hygienist's time. So you want to be making sure that you understand where their production is coming from and if there's an area there for to be addressed.
And I also think that like you have to make sure that you're doing patient education when it comes to billing, because a lot of patients think, oh, like it's only tooth on or instrument on tooth time when it comes to billing scaling units. But really, it's like they're auditing your medical history, they're educating you. They're writing their follow-up notes afterwards. All these have to be included in those
Mhm.
scaling units. So making sure that they are doing that. We usually say about 250 per hour. I think that's
Yeah.
kind of fair for hygiene.
Yeah. And then when it comes to your dentist production, obviously think about maybe you have your junior dentist, maybe you have your more senior dentists who are doing more major or orthodontic work and figuring out roughly what their per day production could be. Your owners could be different from your associates, so having kind of a rough benchmark there.
Looking at new patients, active patients. So, you should be around 1,500 per dentist. That's kind of where you want to say, okay, like I have the patient base that I should be, pretty fully booked. My hygienist should be fully booked. Like I might not see any more new patients. So keeping track, and that also means making sure you're auditing your patients a lot. Like if they haven't been in 3 or 4 years, they're not really your patient anymore. So like you need to kind of either follow up with them or archive them. So making sure you kind of have an accurate count of how many patients you have and like really make sure that you're differentiating them in your dental system. Like whose patient are they? Like are they mine? Are they the associate dentist? So making sure you have a way to track that. And then if you are still accepting new patients, you should be averaging about 20 to 25 new patients per month per dentist.
Minimum. So I would
Yeah.
say, so the 1,500 per dentist comes from roughly per day that you work, you should have a minimum of 300 patients assigned to you. So say if you're a 5 day working dentist, you have your 1,500.
Mhm.
And same goes for the hygienist, by the way. With the 20 to 25 per dentist or new patients per month, if you're getting less than that, your clinic is not growing. So if you're only
Mhm.
getting 10 new patients a month, because we know that the attrition of patients over time, like the silent quitters and that type of thing, your clinic is just staying stable or losing patients. So you want to make sure that you're at least getting this number of new patients per month, and if not, to be looking at ways to grow.
Yeah, absolutely. I think most clinics lose about 200 patients per year. So you really have to keep that in mind when, you're talking about patients and everything like that. Accounts receivable fee should be kind of basically collecting what you are billing essentially. It might not be the same month, but you are either getting it from the insurance or you're collecting it from the patient. This might not pertain to every clinic, but a lot clinics are doing Invisalign, and those stats are also equally important to keep track of. So you want to look at, okay, how many records have I done? How many clin checks have I done this month? Like each dentist, each provider, how many starts and how many finishes? Because it's really important to look at, like, okay, I did, or this person did like 6 records, like 6 clin checks, and only had one start. So there's obviously an issue between doing the clean check and the start. So where are we dropping the ball in that case? Are we not following up? Was there some miscommunication during the clean check? Like, what are we not communicating to close this case? Maybe we need to hire a treatment coordinator. Maybe that's something, if we have the budget for, we should be looking at. So keeping track of these stats are really important for a clinic.
Yeah. As Felicia said, we started to delegate our Invisalign a little bit more, so our hygienists are seeing. So we do like to take account for when they are seeing patients with Invisalign in progress, or if you have anything similar that you use your hygiene team for, it could affect their billing, but it is improving your productivity in the dentist op. So if you have something like this, it's important to kind of keep an eye on it so that you're using a dummy code or something to take accountability for when your hygiene team saw something that even if it's a $0, you know that there's a value there.
Yeah, there's so many dummy codes that you can use too. We have them for pans that our hygiene team takes because, billing a panoramic x-ray has to go into the dentist. But like it's important if the hygienist takes it that we're sort of looking at that and being like, oh, okay, so that sort of adds to the production because they took it, even though we can't bill it under them. Scanning, all these review appointments. So it's really important. I love dummy codes because I think it also gives us more information that we didn't have earlier.
Hmm.
Major equipment updates, I think, is really important. Just keeping track of, okay, what's going on in each operatory sort of thing. There's different clinical zones, right, that you need to be keeping track of. Like, are the
Yeah.
chairs and all the operatories working? Are the equipment, the everything, we need to keep track of that sort of thing.
It's an area that we kind of added into our manager meeting over time because we were really focused on everything up until this point, like the financials and the stats quarterly. And then there were things happening that, oh yeah, that stopped working like 2 months ago. And as a dentist, I'm in my op. I'm in op one in our office, and like I really know nothing about what's happening else in any other op. And even in fact, if I go into any of those other ops, I don't even know how to be a dentist anymore. I'm completely like, oh my God, what's going on? So what we started to do was two different things. Felicia's going to be talking about a team survey that we do, but we also send out a message to our whole clinic and we say, tell me all the glitches that are happening in your operatory before our management meeting. And that could be, a handpiece that starts to spritz water or whatever it might be. And it allows us to have this quarterly check-in where we just go and fix up some tiny little jobs here and there, or, maybe get our equipment guy out for just one session, but with a list rather than session by session and paying for those things. So we do this kind of quarterly roundup of each clinical zone, like each operatory snag list, the steri snag list, and then any other areas of the clinic snag list. And we culminate everyone's input of the little glitches that they've noticed, and we get it all done in, every few months. And it's managed to keep things running a lot better
Yeah, absolutely.
than just having like an out of the blue, this has completely stopped working kind of a scenario.
Yeah, for sure.
And allows us to plan for our spending in the next quarter too, because oh yeah, this sensor's had a line going through it for the
Yeah,
last 6 weeks. Oh my God. Things
exactly.
like that. So it allows us to sort of plan appropriately there.
Yep, for sure. And then one of the last things we kind of talk about is just like a referral out. And I kind of touched on this earlier, but that's really going to kind of help you decide if maybe it's time to bring someone into your clinic. If you're referring a lot to perio, if you're referring a lot to endo, if you're referring a lot for Invisalign, maybe that's something you should bring into the clinic. So again, all of these are really going to do a pulse check on your clinic, and you can kind of see which areas you can grow in, what areas you that need maybe a little bit of fixing or a little extra love, and what areas you're really succeeding in. I think that overall, it kind of really helps to touch base on these things every few months, right?
So
Um,
then the last thing that we do in our team meeting, on top of all those stats, is right before the team meeting, we send out an employee survey. And I've just added it into the chat. It'll be in our resources section of Dental Hive too. And Fel's going to go through that a bit. So, you know, Felicia and I, we run our clinics together, and they run very smoothly. But like every clinic, there's always going to be drops in the wellness temperature of the team, and they can be, you don't see them coming. You're like, a couple weeks ago I said, we've had a really great couple of weeks. You know what that means, right? Next week something's going to happen. And of course it does. And I think it's really good to have these kind of quarterly check-ins with the team just to see where people are at. So that you can try and be like a little bit ahead of those little wellness drops that naturally will come along in any small business. So we sent out the survey. Felicia's going to look at it with you.
Yeah, so we have different surveys. We'll send out one kind of every other month just to kind of check in with the team, see like how they're doing, tell us something about themselves that they're really proud of or someone else that they're really proud of. That's kind of different to the wellness survey. So the wellness survey is done right before a team meeting. And we're kind of just talking about the clinic management, the workload, everything like that. So, we're finding out how satisfied they are with managers, how, like, the communication, the workload, compensation. We're kind of just asking them all these questions like, are you satisfied working here? Like, how can we support you more? How can we support your mental health? Are there other ways that we can help improve your work-life balance? And they find that these are kind of little good pulse checks with your employees to kind of see how everything's doing. This is really going to help with team retention. It makes our team feel really heard and supported when we can fix stuff that they're having issues with. So really important to kind of do this with your team. Like I said, we have different surveys. I think most of them are in Dental Hive. So something really important to go over. again, not just at the team meeting, but in general, you should be doing them with your team and having role check-ins.
And we allow this one to be filled out anonymously because
Yeah.
we want to just kind of get the honest truth. They don't have to answer everything, but we'll look at
Mhm.
it together. And I always different people always take feedback in different ways, and I can find that on my clinical days, I'm really focused on the patients and my schedule and all of that. So I can find getting a little, this person's finding this hard. I find that hard on the fly. So I love to
Yep.
have surveys because I love to have a minute where I can sit down and look at these with Felicia. She's much better at this than me. She's able to bring this all together and bring me lots of solutions. But allowing us to do this and sit down as a management team and look at this from different perspectives and with different eyes can really help us start to make some valuable action points for the clinic. So I think this is
Sure.
a
We can
great.
work on team training. We can do like see what their skill strengths are, whether they're not comfortable with. So you can really kind of work this into your own clinic and ask questions that pertain to your clinic as well.
So at the end of our meeting, we recap on all of the action points that we're each going to take. So, we meet the dentists, like the clinic owners are part of this. The managers and our head assistant who is our clinical manager too. So we meet together, we do this management meeting, and we each leave with action points that we want to get done. That can be training for the team, that can be equipment repairs, that can be some very specific production kind of goals that we have or strategies that we've realized where there's a little bit of a glitch that we need to fix or iron out. And we have a plan. We have a plan for the next meeting. We know when the next meeting is going to be, and we have goals. And this is how we've managed to quarter by quarter really grow our clinic. We have two clinics in Toronto that are really thriving. And by doing this and setting aside this time, it's really allowed us to be able to do that. So I highly recommend that you integrate this into your team. Um, and thank you so much for joining us, Fels.
Yeah,
A
thank
little bit
you.
about our next meeting. I hope you enjoyed
Yeah,
this little quick 30 minutes with us.
yeah. So we are having another LinkedIn live meeting. It will be on comprehensive onboarding for new employees, where we're just going to chat through our onboarding training plans, so that new members can thrive in your clinic. So join us on Monday, June 9th at 12 p.m. Eastern Standard Time. We'll see you then. Thanks so much, guys.
Bye, guys.